Good afternoon, everyone. Thank you for being on for our Superintendent's Webcast. We have a few items to cover with you today. We're trying to keep the agenda very short and focused, but they are really important matters. So today we're going to cover a couple of communications updates and some things that you need to know. They're exciting announcements that we want to make sure that you're tracking and taking part in. We also have with us Dr. White and Dr. Stack from the Department of Public Health. We're excited that they're going to be able to talk to you more about vaccinations and the process around that and how it's going. We know that there have been a few school districts where vaccinations have already started, and we know that over the next few weeks that's going to just ramp up and start moving even more quickly. So we're very excited about that. But there are lots of details that they want to share about that process. We're excited to bring that to you. And then we'll end up with Robin Kinney and Karen Worth from our Office of Finance and Operations on to talk about the COVID relief money, the CARES second round of that funding. It is substantial. It's a lot of money that we're going to have to really offset and create quality experiences for kids who have lost out and missed out on so much over this past year. We're going to have an opportunity to make that up to them in some exciting ways. So I'm excited to talk about that and what our process around that looks like. So thanks for being with us. We do have questions through the Google form today. We're not using the soapbox mechanism to do that, but you can submit questions through the Google form, and we'll gather those and answer those as we go through. But now I'm going to turn things over to Tony for those communications updates.
All right, thank you, Commissioner. We'll go ahead and get started. I just want to make sure, Commissioner, are you seeing my screen with the agenda?
Yes, I am. Thank you.
Okay, perfect. First and foremost, I just want to remind everybody tomorrow is our deadline for the Robinson Award for Diversity and Equity in Public Education. And so I just want to encourage anybody who may have somebody that is willing or able to nominate for this award. This is the criteria there is on the right. Successful efforts in closing socioeconomic and or racial achievement gaps and significantly improving student learning and student achievement or other measured outcomes. Again, this is an award that will be issued by the Kentucky Board of Education, and our nomination deadline is tomorrow. And the link is in that form. It's also through social media. And before you all ask, we will be sending out this PowerPoint at the end of this webcast. We had some late additions, and I just want to make sure for each of you to know that. So when I know that you all will see this and say we can't click on the form, we will make sure we get that to you at the end of the PowerPoint. Also, just yesterday, we announced that our nominations for the 2022 Teacher of the Year has officially opened, and I'm excited to let you know that we already have 94 nominations for our Teacher of the Year. We just sent that out about 4:30 yesterday afternoon, and I'm very excited to see that lots of nominations are coming in from across the state. Again, you can nominate a teacher. Anybody can nominate a teacher. The criteria there is on the left of the screen. We are hoping, I know it seems that you probably are thinking that we just went through this process, and you are correct. Because of COVID, we had a short delay last year, but normally our process here in Kentucky is to do this Teacher of the Year process in the spring, and we are hoping to go back to our normal pre-COVID situation where we were able to get back to our regular Teacher of the Year timeline. And so hopefully we will be able to do that. And that's what we're looking to do. So our nominations, you can look to nominate someone by February 20th. We have also added a section beginning this year called Kde Community Voices. There are several times that the department is always looking for feedback, looking for community members to share valuable feedback. And we'd like you to share this with your districts, possibly for town halls, things like that, looking for feedback on the school report card. If you could share this information with your districts, we greatly appreciate that. We've had several dozen people sign up so far. This could include parents, grandparents, community members, and others. And if you could just help us publicize that, that would be wonderful. The last thing I'd like to chat with you about, and I might bring in Dr. Woods Tucker as well, is just to give you an update on our statewide equity and inclusion scan. Once again, I think you remember a couple of webcasts ago, We talked to you about this scan that Dr. Woods Tucker is kind of conducting. It opened November 10th to our superintendents, and we expanded it to our teacher advisory council in December. We are now expanding this scan to include several more stakeholder groups, including principals, district administrators, counselors, support staff, school board members, and also community members. Dr. Woods Tucker's initial goal is to bring some feedback to the Kentucky Board of Education in February. So again, this is going to be something you're going to be seeing on our social media throughout the next couple of weeks extensively. But from you, superintendents, we are really looking for some feedback by the end of this week. So we will send you some information here at the end of this webcast, specifically with this Google form. And these are the things that we're looking for on that. Dr. Woods Tucker, did you want to add in a couple of things before we move on?
Sure, I'll jump in very quickly. First, I want to thank the superintendents who have completed the initial survey. Thank you. If you have not completed the survey, please do so. I'll tell you very quickly one of the reasons I'm really requesting that you do so. Those folks who are not superintendents who are on this call, we are now opening the survey up to you. So please take some time this week to complete, I think, around diversity, equity, and inclusion. So please take time to answer those 4 questions. It's very important. One, it's some of the most important work that we can do in terms of providing opportunities for the 650,000 plus students here in the Commonwealth of Kentucky, but also to the thousands upon thousands of staff members as well. I'm really excited to have the support of the governor, to have the support of our Lieutenant Governor Coleman, of course, Commissioner Glass's support, and the entire Kentucky Board of Education support through its resolution that passed last summer. We feel that we have some great traction to get some of our diversity programs funded this year, particularly the Kde program, the Kentucky Academy of Equity in Teaching. We're excited about that. And why I'm excited is because this could mean funds for you, superintendents, in your local districts to create your own pipeline, your own grow your own pipelines in partnership with higher ed institutions. And so it's going to be very competitive if we get funded. We've asked for $500,000 to fund this initiative, and this will give you an opportunity to use your own creativity in growing your own. So that's just a couple of reasons why we really want you to do this. But also, it's important that we come together and exchange ideas, best practices to demonstrate equitable opportunities for our students and staff across the Commonwealth. And those of you superintendents, I've talked with about 10 of you, and you've shared some of your feedback, you've shared some of your ideas. Continue doing that, and we hope very soon to ultimately create an equity tool can be used across the Commonwealth and a resource landing page here at the Commonwealth as well. Thanks, Tony.
All right, thank you, Dr. Woods Tucker. And with that, Commissioner, I would like to hand it off to Dr. Stack and Dr. White at the Department for Public Health.
Thanks, Tony. Let me interject just quickly and say thanks again to Dr. Stack and Dr. White for being with us. You're always gracious with your time and answering questions. And Dr. Stack, I wanted to say to you, I heard about the vandalism that you had at your home. All of us on here are public servants that are used to making impossible decisions, and you've been saddled with making a lifetime of impossible decisions over these last several months and dealing with COVID. It was despicable what happened to you, and I can, as someone who's experienced something similar, understand how invasive and offensive it was. So please just know that we respect you as a medical professional and as a public servant, and we're grateful to have you working with us. So just wanted to mention that as we got started. And let me turn things over to both of you now.
Thank you, Commissioner Glass. I really appreciate that. I know we all hope for better days, and I know we all recognize the importance of urging our communities to be calm, to find what unites us rather than what divides us, and to recognize that all of us will ultimately do better if we work together. That division and dehumanization, depersonalization objectifying people instead of treating them as our fellow men and women all leads to a very dark and dangerous place. And unfortunately, we're seeing that happen now. So thank you, and thanks to all of our colleagues here who are leaders in your communities and are trying to help us model that behavior for the students and the children that we're all helping to raise and educate. Well, now let's turn to a topic that's of interest to everybody, the vaccine. Just when I thought my job couldn't get harder, it did. I think we saved the most daunting and difficult logistical task for the very end. We are now in the situation where instead of not having stuff, we have something, though we have nowhere near enough of it. And so everybody thinks that, we're withholding it from them or they're somehow being disadvantaged relative to others. So let's talk very specifically about schools. The governor has messaged consistently. We have shared publicly, we discussed with Commissioner Glass and KDE that the target for the K through 12 school personnel had always been February 1st plus or minus 1 week. So January 25th would be the Monday before February 1st. That had always been our target. Well, when I say always, I mean this whole thing has been less than 1 month at this point. December 14th is the first day that we had a vaccine of any sort. But that had been our target, and that went off the rails right away because we started having communities take their own independent actions, and even entities that had no role in this project. And they were doing it to try to be helpful. They were, everyone here, I think, is trying to do the best they can to be helpful to their communities. I'm grateful for that. I appreciate the spirit of community, but it makes it impossible to execute a program this complex. And I want to give some context and some perspective on this, and I want to enlist your help, and then I'll give you some details. So the vision for this that I had was to work with a couple large commercial partners so we could use retail pharmacies that I could assign each county to one of these two partners, and that they would then have a standardized process that they could do cleanly, efficiently, and to everyone's satisfaction. So all of your employees could walk away and say, wow, that was really nicely done, and we got it done efficiently, and everyone was happy. Well, local control stepped in immediately and made that a pipe dream and undermined it immediately. So there are reasons for that, reasons that are positive. A whole bunch of you have very good relationships with your local health department. Thank you. That's something to celebrate, not something to criticize. I'm really grateful for that. But it makes it much harder now to operationalize across all these different health departments that each have different infrastructure. Some have in-school nurses, others do not. Some rely on partners like federally qualified healthcare centers, others do not. Some don't have the resources or the infrastructure, and I still have to come up with a solution using a commercial pharmacy. So what this became was, instead of a turnkey approach with a couple strategic partners, this became a very painful and laborious 120 county at a time project to make a custom-built program for each and every one of the counties. I'm sure that you all appreciate how difficult that is, particularly in light of all the other tasks that we're trying to accomplish. Nonetheless, the governor is committed, and I am committed to fulfilling this promise, that all the K-12 school personnel will have had access to at least one opportunity to receive vaccination before the end of the month of February. I want to put that in context. We have phase 1A and 1B. In 1A, you only have healthcare personnel and nursing home residents. In phase B, you have K-12 school personnel. You have first responders, firefighters, police officers, corrections officers. You also have the K-12 community, and then people who are 70 and over. That is phase 1B. If you add up everyone but the 70 or over, you end up with only less than 400,000 people in the whole state who are getting sort of prioritized access above. And I put the 70 and over in a different category because they alone are about 490,000 people. So K-12 school personnel have been put almost at the very front of the line. Every K-12 school personnel that should have the opportunity to be vaccinated, to have at least started the two-part series, and the vast majority will have completed the two-part series before the end of February. That means they are getting a custom curated, personally delivered, defined location to go to get a vaccine. That is the envy of just about every United States citizen across the whole country who would like to be vaccinated. So I'm going to ask for your help, please. We have already had times, and I've already had communications from some educational leaders, which quite frankly were disappointing to me, where they expressed outrage about somehow the perception of being disadvantaged because I had said early, the very first week of January, when this was just beginning to unfold, that I had asked hospitals to please not jump in and go vaccinate schools when I was trying to coordinate a complex program for a whole state. And so I would just ask people to understand with a spirit and a heart full of gratitude just how special and unique this is, the priority that's been placed in Kentucky to ensure our educational staff are protected as much as we can and that our kids can get back to school as quickly as possible in the safest possible environment. I think this is actually unique across the entire nation, the emphasis we have placed on assisting K through 12 specifically. So please, we will get everyone addressed and we will do it quickly, but everybody can't all go at the same time. And I want to put that in context. We get about 53,700 doses of vaccine every week. That's it. That's all we've been getting. Now, the Biden administration's announcing some new directions, but there's a lot of confusion and complexity for how that's going to work. I want to put this in context. I know already, based on lists you submitted and that Dr. White dutifully curated for me, we have at least 83,000, probably significantly more, K through 12 staff across the state who have said they want to be vaccinated on the list that you collected and provided to us. It would probably be closer to 120,000 or more, I think, but I suspect there are folks who have decided they don't want to get the vaccine at the very start. So if I need 85,000 to 100 doses of vaccine, I think we probably haven't captured all the private schools yet, so that's why I go up as high as 100,000. That is nearly 2 full weeks of the entire inventory the entire Commonwealth of Kentucky gets for everybody. And it is just simply not possible to not continue to try to reach healthcare personnel, to not continue to try to reach vulnerable populations, to not begin, at least in some measure, reaching people 70 and over. So though everyone in your communities will have the opportunity to have the vaccine before the end of February, everybody can't all be done in the first week or two. And in that regard, this community is in line with everybody else in society who wants the vaccine, that they want it sooner than it can be provided. But again, to put in context, this community will get it earlier than just about everybody else. So here's the details I wanted to be able to give today, but because it continues to change, I don't have the specifics for each county to give today. But let me tell you this. You already know this, there are a handful of counties that have already started vaccinating your schools, and I'm in communication with those health departments or the hospitals in making that work with them. There are other entities that will begin doing this, and so we've had some major health systems who have stepped up and said, hey, we'll help out, we'll take care of the schools. They will work directly with your health departments and with your superintendents, because what I want to do is make sure that for each county, there is a designated contact person for the vaccinator so that any school leader can identify themselves to the vaccinator, send in your list of people. And remember, the reason I've asked you to make a list, and I had said first name, last name, date of birth, and gender, was because we have enough vaccine hesitancy that more than 30% of people offered the vaccine don't accept it. I can't ship excess amounts of such a scarce resource and have it not get used and then have it used in untargeted populations just yet. You already see the press coverage for the challenges that creates. So if you at least ask your staff to identify who wants it, that decreases the likelihood of large numbers of people who are added on your list who really don't want the vaccine and don't show up to get it. So in order to do this, I have to stage vaccine deployments across these counties in a way that disperses it over time so I don't have to completely stop reaching all the other populations that are ahead of you in 1A, and then also that are alongside you in 1B. In my view, I anticipated I'd have to spread this out over at least 4 weeks, possibly 5. We have already begun now in some counties. And so now I think that we will probably have most people's first doses administered before the middle of February, which means that then 4 weeks after that, by the middle of March, the second dose would be completed. It's very hard for me to tell you that with certainty. I need your help. Please reassure your judge executives, reassure your mayors, reassure your workforces. This is being done. I'm looking at a spreadsheet where I'm trying to track and curate this. I'm not tracking every individual school. I'm not tracking how many people are getting vaccinated in each county. Someone else can do that if they want. My mission, my task, is to make sure each county and its public and private school leaders know who to contact, identify how many of your people by name want to be vaccinated, and then to ship the necessary quantity of the vaccinator to work directly with you for how and where the vaccine will be administered or delivered. Please remember, this means that some of them may say, hey, you got to come to the hospital and go to a drive-up, kind of setting, or a drive-through setting. Some may say you have to go to a pharmacy. Some may say we'll come into your schools. Those of you as school nurses may have that kind of approach. This is very difficult, and in each county, you all know your infrastructure and your circumstances vary tremendously. The commitment is to make it available and to deliver it in a way that is as easy and convenient as possible. But again, I ask you, please, I simply can't accommodate everybody's special preferences and requests. It's just not possible. If any school personnel decline, which is their freedom to do, to decline the vaccine, once I go through each county once, they are welcome to schedule at their convenience at any location that has vaccine and identify themselves as an educator. But we won't be going back repeatedly. This is one bite at the apple per county. One bite of the apple per county as I go through and do this. It is my hope. I had hoped to have this for today, to give this to Commissioner Glass so he could distribute it to all of you. But as recently as yesterday and today, I've had more hospitals say, hey, we'll help out. And health departments ask me to take your county, and use the hospital or someone else who had inventory and could begin immediately, rather than having you wait multiple more weeks for an outside partner to do this. So we will have a letter by the end of the week where I will describe what the process in general would be for those of you who have not yet started. I will come up with a production schedule so that I can say when counties should expect to receive the vaccine so they can begin this. And that should give you clarity over the middle of January, I hope, through the middle of February, when people will start the vaccination series if you have not already and are not yet finished. So I hope that helps put this in context. I guess you could say we're way ahead of schedule because in at least one county, vaccination was finished last week on Friday, and other counties are starting now and will soon be finished. Remember, smaller rural counties in some ways are easier to do because the population is so small. If I go to Jefferson County, the health department director there needs 20,000 doses of vaccine, which means that you are talking about, what is that? That's not quite 50%, but it's mid 40% of all of the vaccines for the whole state just to get K through 12 personnel in Jefferson County. So again, I ask you, please put in perspective, if it has to take a few more weeks to do this, just how difficult this task is and the sacrifice the rest of Kentucky is making because we value the educational community as much as we do, and we value what you do for our children and helping us to build healthy young people into healthy young adults who can help us hopefully repair and restore society to ways that we all get along with each other and treat our family, friends, and neighbors with the love and respect that help us to have a wonderful Commonwealth and a wonderful nation. So, Commissioner Glass and Tony, I hand it back to you. That's what I have for today. And again, I will have for you more details by the end of the week where I hope to have a production schedule for when counties should expect to come up in queue for their vaccinations.
Thank you, Dr. Stack. Dr. White, I know that you're on with us too. Is there anything else you'd like to add following Dr. Stack's remarks?
Yes, I will go back to Dr. Stack's Etch-a-Sketch. We had the Etch-a-Sketch shaken this morning. I haven't even read the article, but I understand that the Trump administration is talking about releasing doses. Like I said, I haven't read that. I don't know that for sure. I know they're wanting us to do 65 and over. So it's not like we haven't thought of these things. It's just how we are going to roll this out. I'd like to share a couple of slides. I did a presentation this morning for our we had to do a clinical webinar once a month where we talk to clinicians, and this is a slide that I pulled off that I wanted to just go over with you some basic information about the vaccine itself. As Dr. Stack said, 70 and older is going to be the group that's in 1B along with education personnel, because 75% of our deaths are in patients, are people over age 70. I've heard folks say, well, they're just a bunch of old people in the nursing home. That really doesn't matter. Well, shame on them to think that. But 43% of the people over 70 that die are in long-term care facilities. That means the rest of those people are not in a nursing home. They are functioning in our society, and they are all people that are loved. The vaccine itself, it is a safe vaccine. People say, well, it came so fast, they must have cut corners. They must have done something unsafe. Absolutely not. The FDA has approved this. The CDC has approved this, and all safety measures were taken for this vaccine. It's just that the development, when it was able to go faster for a whole host of reasons, but the vaccine trials were done as appropriate, and I feel very safe in recommending this for my 91-year-old mother who's waiting for her turn to get her vaccine as soon as I can get her on the list in her local health department. The availability of the vaccine, I think Dr. Stack covered this perfectly with our 53,000 doses. And again, this will probably change over the next little bit, which is why it's so difficult for us to predict a timeline. Everyone wants a timeline, and I don't have one because things are changing. Rest assured, we are trying to get this out as quickly as possible to any willing person to receive a vaccine in the state of Kentucky. Vaccinating those who have had a COVID-19 infection. It's important that if you have had a COVID-19 infection, you do have some immunity after that. But according to what we can tell from the studies, it's a shorter immunity, and it's not nearly as strong as the immunity that you will get with a vaccine. So we certainly don't want people that are actively infected with COVID-19 coming in for a vaccine, but when they are not infectious, then they can come and get vaccinated. So if that question comes up, I wanted you to know the answer to that. This is really important, the need to continue mitigation after you've received a vaccine. This question is coming repeatedly, and I want to make sure that all of you hear this. The studies in the clinical trials that were done showed that people who received the vaccine had less severe illnesses. The study was not designed, at least we don't have the data now to show, did they not get COVID-19 at all? So we can't say Connie White got the vaccine, she'll not get COVID-19. What that says is when I get my vaccine, I haven't been vaccinated yet, but when I get my vaccine and I get COVID, if I get COVID, my illness severity will be much less. So it's very important that after I get vaccinated, I still wear my mask, I still do my hygiene, I still stay socially distanced. Remember, I've told you, hands, face, and space, that's very important. I still need to keep doing that because I could be exposed to someone, I could contact COVID-19, I won't get as sick, but I could still spread it. So if you have been exposed to someone and would normally go into a quarantine period, you will still need to do that, even if you get the vaccine. So I think it's important that people understand that I think folks think this is a get out of jail free card, and it absolutely is not. It just decreases your severity of getting ill. So I think that's a real important one. And then the last one, I used this in the clinicians webinar this morning. Vaccine hesitancy is in some parts of Kentucky is just much higher than I would have ever imagined. So I am asking you as a group of professionals, as thought leaders in your community, be that example of your community when the time comes for you to step up and get your vaccine. Put that on your Facebook page. Let people know that this is something you feel is important for the health of your community, for health of your school community. And make it very visible that this is something you are doing for the good of your area. This is a slide we're going to send out. As Dr. Stack said, we will very likely not have vaccine for everybody in every school. Some of your smaller schools will be able to cover those. But in talking with the KDE staff, we talked about some different options that you might think about. If you can get half of the vaccine one week and half of the vaccine the next week, people will be looking to you to decide who gets it first. And these are just some different things that we thought you might want to think about. You might come up with another option, but we talked about some schools are thinking about doing K through 3 grade levels to try to get the younger kids back first. Some are looking at people by age and their comorbidities, their illnesses. Some are looking at exposure level. I know there's one school that's going to do bus drivers and cafeteria workers first because they're exposed to everybody in that school setting. You may want to look at the staff that are around your at-risk populations. There are some places that are actually doing a lottery. I found that fascinating, but some people are doing that. You may do first come, first serve, but I think your community is going to be looking at you to see who goes first in this process. So these 2 slides will go out to you in the queue when Tony sends this out, and I will be here for questions for the COVID, as well as I'll stick around because somebody will think of a question later, and I want to be available if at the end of the day, at the end of the afternoon, there's any other questions. So that's all I have, Commissioner Glass. Thank you.
Great, thanks so much. Let's turn things over to, let's see, we've got Robin Kinney and Karen Worth on to talk a little bit now about the CARES COVID relief money, the ESSER 2 and GEARS 2, I think it's called now. So I think Dr. White's going to be able to stick around with us for questions. Dr. Stack, you're welcome to stay around too if you're able, but otherwise, thanks to both of you. Let's go ahead and turn things over to Robin and Karen.
Thank you very much, Commissioner Glass. It's a pleasure to be with everyone today. Often in my role, I don't get to share as much good news as I would like, and today's presentation is about good news for Kentucky students and for local school districts. If we can stay on the first slide, I'll give you a little bit of background for those of you, but I'm sure many of you have already been following very intently the Consolidated Appropriations Act of 2021. This act was passed by Congress and signed into law by the President on December 27, 2020, so it is hot off the press. The act is a $2.3 trillion spending bill. It's comprised of a $900 billion in stimulus relief for the COVID-19 pandemic, and then a $1.4 trillion omnibus spending bill for the 2021 federal fiscal year. I think it's interesting, and I can just share with you that according to the U.S. Senate Historical Office, the act is the longest legislation passed by Congress with 5,593 pages. So it's got a lot in it. It combines 12 regular appropriation bills and also provides for legislation to address all kinds of economic support for businesses, individuals, benefits for vaccine testing and health providers, and what we are most interested in today, funds for education. Next slide, please. Tony, are you on slide? I'm sorry, I'm seeing a different slide. I'm looking for slide 2, Consolidated Appropriations Act slide. Okay, thank you.
Is that the right one? I might have double
Yes,
skipped. Sorry about that.
Yes, it is. Thank
Okay.
you very much.
All right.
While the Act is comprehensive in nature, today we're going to focus on K-12 education funding. That is the Coronavirus Response and Relief Supplemental Appropriations Act. You'll hear a new acronym called CRRSA, CRRSA, and that provides the additional funding for the stimulus and pandemic relief. And then we'll talk about the fiscal year 21 additional education fund appropriations. And then our presentation today will also touch very briefly on ancillary provisions, which may be of interest to our local districts, including broadband, PEBT, and the Coronavirus Relief Fund extensions. CRRSA does include a total of $81 billion split between 3 funds for all the states, and those are displayed on the slide. Next slide, please. So let's talk about the breakout for the $54.3 billion for ESSER 2. Again, this is the national amount for all public K-12 schools, and the $4.05 million for Year 2, which does include a $2.75 billion set aside for services to private K-12 schools. And we'll discuss this set aside a little later in the presentation. As with prior ESSER and GEAR allocations, districts may utilize for expenses incurred back to March 13th, 2020. So you can take that look backwards for expenses already incurred. And with this second round of funding, funds will be available for obligation through September 30th, 2023. Next slide, please. Let's look first at the provisions of ESSER 2. And this funding is being billed as the largest, most flexible discretionary K-12 fund in history. ESSER 2 is being described as a supplemental funding to ESSER 1. And we remember that was provided under the CARES Act in the spring of 2020. And ESSER 2 will have many of the same broad provisions for flexibility of uses as ESSER 1. We are very pleased that USAID has announced their intent to continue to offer a very simplified process for access and receipt of funds in an expedited process, and that was true under CARES, and it looks like that's going to continue, making it easier for all of us. And the Commonwealth has already received notice of the amount of our award and will have district allocations for ESSER 2 posted following our webcast today. As with the original CARES Act funding, there will be continued encouragement to use these funds quickly and effectively on behalf of students and school districts, and states will be asked to communicate often on how we are expending those funds. However, it is a significant amount of funding, so we are encouraging you to continue to be very strategic as you have in the past in your planning on the use of the funds. Next slide, please. The overall allocation for all states, similar to ESSER 1 for ESSER 2, is based upon Title I, Part A formula allocations, this time for fiscal year 21. And this has determined Kentucky's allocation of $928 million. Allocations to districts will also be based similar to the first round of ESSER, based upon Title I allocations. While district amounts will be posted later today, I just want to share with you that as a rough estimate, allocations for your district will be approximately 4 to 5 times the amount of the original ESSER 1 allocation this round. So it is a significant sum of money that will be coming to our districts. But of course, as we know, there's a significant amount of work to do. I want to pause just for a minute and thank you very much for your active participation and advocacy for additional funding. I reached out and received lots of input from superintendents, finance officers, and educational partners who really helped us to tell the story of expenditures of the ESSER 1 funds and the timing of those expenditures. And I really think it was that advocacy by all the states that resulted in this significant funding, which is certainly needed and appreciated. From a high-level logistics, we are going to be requesting some new assurances and a spending plan, as we did with ESSER 1. There will be reporting requirements as required previously, and KDE will be reporting how funds are being used to address learning loss in the Commonwealth. And we'll talk a little bit about that in subsequent slides. And even though ESSER 1 and ESSER 2 will have the same CFDA number, they will need to be tracked separately. So finance officers will be receiving additional information on new Munis project number for coding of expenses. If we discuss the fund uses, there are broad uses of funds for ESSER 2. Some of these will be very familiar. They were permissible under ESSER 1. Any allowable activity under ESSA, IDEA, Adult Ed, Perkins are all, again, permissible activities and uses of funds. Of course, coordination of COVID preparedness as you continue to have needs for masks and sanitation, thermometers, all those types of preparedness and response measures are also permissible uses. You'll see on this slide in bold 2 new uses that have really been highlighted. The first is addressing learning loss, including the use of payment for assessment, evidence-based activities, parent engagement, tracking attendance, and improving student engagement. And then the second one that is new this time, a look at school facility repairs and improvements to enable operation of schools, reducing the risk of virus transmission, and improving your indoor air quality. That's something that has really been highlighted this time and is new and different from the first round of ESSER funds. And then any other activities that are necessary to maintain your operation and continuity of services. You'll see here a transition really from ESSER 1 to ESSER 2 in the information provided around federal funding, from the more along the preparing and maintaining the needs to operate in the pandemic, which are all necessary. Still those masks, gloves, sanitizers, Chromebooks even. Those are all still needed and permissible uses. But you will start to see that ESSER 2 begins shifting to really looking at the expenditure of funds for examining and assessing the effectiveness of instruction and mitigation of learning loss for our students. I know that's something that's already very much on the minds of our districts, our superintendents and their staff, and trying to see how they're going to navigate through that. And ESSER 2 really encourages the use of funds to determine the level of and to address learning loss. So we've put together some permissible uses on this slide, and the following slide, if we can go to the next slide, please. Next slide, please.
Is this the right one?
No, the next one, please. It's like it's stuck.
Yeah, I'm trying here.
There we go. Thank you.
Yeah.
So, and we've already received some questions from our districts about other permissible uses. So we just put a couple more on there. Nurses, again, to support the activities, to support health of your students and your staff, mental health professionals, and employee emergency leave days. These are all things that are permissible for expenditures from ESSER 2. Next slide, please. Thank you, Tony. So the other part that we'll talk about today is GEAR, and turning to GEAR 2 allocations. $4.05 billion allocated for GEAR 2 for all states. Kentucky's allocation for public schools is $19.5 million. We don't have the district-specific allocations for GEAR 2 at this time, but of course, as soon as we have that, we will provide that to districts. As with the first round of GEAR, the Department of Education will work with our cabinet and the governor's office to receive guidance on the full amount allocated to K-12. The uses of funds is similar to GEAR 1, but for GEAR 2, the state is not required to utilize the funds in the same manner as we did in round 1 of GEAR funding. If you'll remember, we worked with the governor's office and identified 2 kind of big areas for use of GEAR 1 funds. That was for technology and food service expenditures. And the state could choose to use that in the same manner, or they could use it for another purpose. So we'll work with the cabinet and the governor's office as we get additional direction and guidance from them, and then let all districts know about what that's going to look like. I will say, as I presented earlier in the presentation, the Commonwealth will also receive $40.8 million for emergency assistance to non-public schools. And KDE will be responsible for managing the allocation to those individual non-public schools. And there are no equitable service requirements for Gear 2 for local school districts. So local school districts won't be necessarily dealing with that. That will be handled at the state level. And as I indicated, we will let districts know as soon as possible additional information on Gear 2. Next slide, please. So I wanted to just share with you a few additional kind of ancillary topics that may be of interest for local school districts, their students, and their families. Even though some of these will not be administered by the Department of Education, but you may hear about these or get questions. Continuing the efforts to close the gap of broadband for families, whether we're talking about students or families and parents that are working remotely. There is a $3.2 billion for low-income families to access broadband through the Federal Communications Commission. Individuals will be eligible for a $50 monthly internet subsidy, and providers are going to be reimbursed $100 for issuing a Wi-Fi connection device. I think we've made great strides for our families and students for access to internet over the last, really during the period of the coronavirus pandemic. But this is another way that I think Congress recognized the continuing need to access broadband and is providing this as another avenue for families. I will note that the bill does define one method of eligibility through participation in the free and reduced price lunch program. So that's how we may hear more about this program, or you may get questions from those in your community. As we learn more about the broadband kind of supplement, we'll be sure to pass that along to you as well. Next slide, please. As we also talk about the Pandemic Ebt Program, this again is something that is administered primarily at this point in time by the Cabinet for Health and Family Services. However, the Department of Education does play a partnering role in this. PEBT is reauthorized from October 2020 through September 2021 by this Continuing Appropriations Act and other Extensions Act. So what will happen next for what we're calling round 3 of PEBT, a plan has to be submitted by the Cabinet for Health and Family Services to USDA, as was the case in the prior 2 rounds, and that will have to be approved prior to distribution of benefits. We are currently working with the Division of Community-Based Services on how this next round will roll out. The states will be able to use simplified assumptions to average benefit amounts in this phase. And this is, even though we don't have a lot of detail around this yet, this is likely to be related to that in-person versus virtual days. There was, in the last round, a need to be virtual so many days. And so I think they're going to try to expedite and maybe make that a little easier to get through. It is expected that non-CEP schools, including all the ones that are operating the Summer Food Service Program, will need to have processed USDA free and reduced lunch applications for round 3. So we will provide a deadline to schools to do that at least 6 weeks in advance after notification of the USDA plan approval. So our Division of School and Community Nutrition will, of course, be the lead on this and will provide information to your food service directors. Next slide, please. I've also included this slide, which really just contains some bare bones language from the Act, but wanted really to just make you aware. And I would file this slide under, I guess, what I would call maybe another glimmer of hope. There's some language in the Act that talks about partially reimbursing school food authorities and daycare centers for costs incurred due to the pandemic. And what we are thinking this may be are for those districts that have incurred expenditures in excess of reimbursement rates from USDA. This may be another opportunity at some additional funds. We have very, very little information on this, even though we're reaching out to the USDA, trying to get additional details. Again, we'll provide those to you as soon as we receive those. But I file this under another glimmer of hope for our school districts. Next slide, please. Finally, I want to touch just for a minute on increases to the federal fiscal year 21 appropriations. This is all good news. We see increases for Title I, increases for IDEA Part B, and increases to Title II. Also, just of note that may be of interest, again, not administered by KDE per se, but increases for Head Start, Child Care Development Block Grants, and child care funding for providers and families. We have talked throughout the pandemic about the really need of child care facilities to be open and thriving, and the ability for parents to return to work and have child care providers that are available. And so there is some money in this act that would provide child care funding for both providers and their families so that they can get back to school and work. Very good news from that end. Next slide, please. I've put in a slide about employee leave, just to emphasize that the prior emergency leave that was authorized under emergency family and medical leave or emergency paid sick leave, it was not extended past December 30th, 2020. So it was not extended by the federal government. However, just as a reminder, we want to make sure that districts continue to be aware that the emergency regulation passed by the Kentucky Board of Education does permit districts to provide employees unlimited COVID-19 emergency leave days. And with the funds that will be coming from ESSER 2, you could consider to use some of those funds to support those emergency leave days. It is a local decision in that regard to use that funding and to utilize the emergency regulation provided. We do point out that CRISA does require entities that are receiving funds to the greatest extent practical continue to pay its employees and contractors. Next slide, please. And then finally, the Coronavirus Relief Fund. We'll remember back in December, we were really scrambling around because we had received coronavirus relief funds from the Office of the State Budget Director. Much appreciation again to all of your staff and the staff here at KDE that worked so hard to get those funds out and to get the appropriate actions taken on those funds. We did that all before December 31st of this past year of 2020. And then sure as we did that, once you know, they extended the deadline for the ability to spend those dollars. So anything under the Coronavirus Relief Fund has an extension of expenditures until December 31st, 2022. We also have those last mile internet funds for the broadband to go to the students' homes or wherever their other kind of work location is. And we do have an extension of that deadline for those funds as well. But I would highly encourage for districts to go ahead and expend those dollars. If you'll remember, we thought we only had until December of this past year. So we may have some things that kind of spill over into this last part of the school year. I would encourage you to try to spend it by the end of the school year, not wait until December of next year. And I know some of you have been working with your providers on the invoicing and billing. So this extension will also allow you to kind of work through some of those details of billing. So, and then as we roll along, if there's any balances of the last mile internet, we'll also stay in contact with you on that. Next slide, please. That's all that I have. I tried to go through very quickly. I know some of it was at a very high level. We will continue to provide information to you. We also anticipate that we will be doing a guidance document. So we'll be doing guidance documents around ESSER and GEAR round 2, just like we did with round 1. We'll also delve, as we get into that guidance document, some other reminders that we contained in those earlier versions. For example, when we're talking about special ed dollars, reminding ourselves of maintenance of effort requirements, and working with our Office of Special Education and Early Learning on what that looks like. All kinds of other details will be coming forth in our guidance document, but this is just a high-level overview so that we could start really thinking about all the great uses of this funds that will be coming our way. I appreciate the time to be with you this afternoon, and I'll turn it back over now to Commissioner Glass. Thank you.
Thanks, Robin. Great information. I hope that all of you are excited to hear that news. And I guess we have, Robin, a new acronym or a new mouthful of words to say. CRISA instead of CARES. Is that the new thing?
That's the new thing.
CRISA. Okay, I'll have to get used to that.
Until it changes again.
As long as it comes with a boatload of money like this did, they can change it all they want. So that's good news. This is a significant investment of dollars. I mean, $920 million for Kentucky is a lot of money, and we're going to be able to do some really exciting things for kids that have missed out on so much over these past several months. Some things to think about, and I just want to prime the pump and get you thinking about how could you use programs like extended day before and after school programming for kids? How could you use services during your breaks? How could you create summer school experiences for students or other learning experiences for students? How could you come back to school early or create extended school day, extended school year programs for next fall? With a focus on creating quality learning experiences for students. I think the last thing that we want to do with any of this is put kids into an environment where we're focused on assessment and drill and kill basic fundamentals, or heaven forbid, putting kids in front of an online program in a room for some period of time. So I really advise and ask that all of us start thinking about what are some ways that we can create meaningful quality learning experiences for kids in Kentucky with these funds. We are likely never to have this much discretionary money in our lifetimes again. We're never going to have an opportunity to create these kinds of experiences for our kids. So we should be excited about that, and we should also really be strategic and thoughtful about the kinds of things we will be able to do with this. I'm excited about it. I hope that you can tell. Building on what Robin said in terms of process, we wanted to give you this flyover today of what these funds are looking like and have you start thinking about some possible uses. We also are going to issue more detailed guidance on it, probably around the beginning of February, early February or late January, that time frame. So you'll have more information around the specifics of what funds you can expect and more parameters around what that looks like. And we'll cover that again at our early February Superintendent Webcast again. So we're going to go into more detail on this. Then we want to give you a few weeks to ruminate and consider and think about how you might use these funds. And then what we want to do is bring everybody back together. We're going to have a panel of superintendents, and what we want to do is have some districts that present their plans. Here's what I'm thinking, to start that sort of cross-pollination of ideas around what these programs might look like. But again, start thinking about it now. This is incredibly exciting news, and we're going to be able to do a lot of good for kids with these resources. And if you have connections to our congressional delegation, make sure you tell them thank you for this. This is significant. We're going to be able to do something great. Tony, let's go to question and answer section. So I think we've got some questions that have come in the Google form. A lot of them look like they're coming in for public health, so I think Dr. White is still on with us. I'm not sure if Dr. Stack is or not, but let's just work through them and we'll sort them out as we go.
All right. So I guess we'll start with, we'll go with the public health ones first. Going back to kind of some quarantine questions, Dr. White, if someone receives both doses of this vaccine, do they still have to quarantine if they are deemed a quote unquote contact? And if so, if this gets out, they're just wondering if they're going to be less likely to get the vaccine. So will they still have to quarantine if they get this vaccine?
Yes, and let's start with why would you get the vaccine? You're getting the vaccine to decrease severe illness in yourself. That's what the vaccine is for, is to decrease that illness. To keep, you've seen. I have a 89-year-old uncle with leukemia and diabetes, and he got COVID in the assisted living, and he lost 20 pounds, and he watched the Ravens play on Sunday because it did not kill him. And you have seen plenty of younger people who, with no comorbidities, got COVID and died 4 days later, and everything in between. So the vaccine is to prevent severe illness in people. As I said before, we do not have data that shows it will keep you from getting COVID. So you are still at risk of COVID to be exposed to it, which means if you are exposed to it and you do become infected with COVID, you can still spread the virus to others. So the vaccine you get for yourself and the mitigation action, the hands, face, and space, is for others.
Okay, and then kind of a follow-up question following that one. Same thing for students and staff who have already had COVID. Mm-hmm. Is that the same kind of answer for that one?
It is. When you do have COVID, you do produce some antibodies. And I know I looked at some of the questions, so I know later on there's antibody questions. If you have antibodies, aren't you good? Well, you don't know how much antibody you need to make you completely preventing you from getting the vaccine. So you'd have to have serial antibodies to figure out what your level is and when do those levels go away. We have seen people who had a positive COVID test in August, have 3 negative COVID tests, and then have COVID again in October and die from that COVID. So you don't know when that window is. So you are to assume, I would assume, if I were COVID positive, I got through my isolation, I got through my symptoms or no symptoms, that I can recatch COVID. We know that happens. And if I can recatch it, that means I can spread it. So in order to prevent it spread to others, and I hope that answers the question, Tony. Okay.
I believe so. Yeah, there was just a follow-up.
Sure.
Just wanted to make sure clear, because these are questions that come into them for the
right. Really good questions for people to understand. Thanks for asking.
And then there was a follow-up question just about the distribution of the vaccines. And for those of our superintendents or listeners who were tuning in later, this webcast will be archived on our KDE media portal. And so if you want to tune in, Dr. Stack did join us earlier to discuss a little bit about why some of the districts are receiving the vaccine prior to the February 1st kind of tentative deadline that was set. So I don't think we're going to go back over that information.
I do want to talk about distribution of the vaccine across the state, because I did cheat and read ahead and saw a few questions. So when we first got the vaccine, we were looking for willing providers, people that would take the vaccine and follow the framework. And now we are reassessing where the vaccine is going to be sure that it is going to population centers. So we actually took the ad districts across the state and looked at where we have distributed the vaccine, and we got very, very close. So there's going to be some leveling out. So some places that got vaccine every week are not going to be getting either as much or any until we level that out. So all the larger population centers are getting a larger percentage of that vaccine, because that is fair and equitable. Okay.
Another question on whether they need to still submit names for the vaccine, or will there be a second window?
Okay, that's a great question. So I spent a big chunk of my Christmas holiday with rosters. So I am done with rosters now, but I can't thank you enough for those rosters. We had absolutely no idea in trying to plan for this how many vaccines we would actually have requested to us. So all of you 267 entities that I sent emails to over the holidays. I really appreciate that. And so that gave us at least a range, so we had an idea of what we were working with. Don't submit any more rosters to me. Now that we have that general idea, what you need to be doing is when you do get, if you don't already know from communications, when you do get notified of who your vaccinator in your county is going to be, use that updated roster and give it to them. And then they will tell us how many doses to order for that community. So for those of you who said, gee, I had, Mary Lou went and got it done someplace else and she wants to give her vaccine to George, and Roger decided he doesn't want it, but Nancy does, just keep that updated in your roster. So that when, and you can continue updating that roster until you make that communication with your vaccinator and they say, we're going to put the order in tomorrow, that's when the window closes. But you don't have to worry about sending me those rosters anymore. But thank you so much for doing that.
Okay. The next question, one of the superintendents indicated that their local health department coordinator submitted an order for vaccines for their school system, and that he was told that the order was rejected. Are you aware of this, and do you know why?
Yes, and that goes back to Dr. Stack talking about how we are trying to plan a rollout. The reason some of these areas, and I know one of the first ones, their particular local hospital had a very large percentage of the hospital staff that said, we do not want the vaccine. So they had more doses than they needed to vaccinate their facility. And the number was very close to what that local county needed for their school system. So rather than not use those vaccines, that arrangement was made to use that. In this particular county, and I happen to know that county, they've used all of their vaccine, as we have asked people to 90% of it to be inoculated within 7 days of receiving it. So right now, until we can start to accumulate some doses specifically earmarked for school, we don't have that. We don't have a stash of doses right now to send out. And that's why Dr. Stack's trying to work on a way that he can systematically accumulate these doses, and then we can start sending those out to all of those local either health departments or Kroger's or Walmart or whatever facility is going to be vaccinating in your county. So it isn't that we dislike you. It isn't that we don't think your teachers and your staff are critically important. We think every county is critically important. We are just trying to take those 53,000 plus doses we give every week and as carefully and efficiently as we can spread that across the entire Commonwealth. And that is not easy. And it's very difficult and heart-wrenching to send emails to people saying, I am sorry, I know your sister is sick, but we are trying to get another phase of people vaccinated first.
Okay, just a clarification on, there weren't, just wanted a clarification. So will staff still have to quarantine after they are vaccinated?
If they are exposed to someone, the vaccination does not guarantee they will not catch COVID-19. So yes, they will need to quarantine so that they don't expose someone else in case they are infected.
Great, thank you. All right, going back up, I'm going to go back and look and see. We have a couple more here that are, oops, I just made that whole column green and that was not my intention. I'm trying to color code for all my OCD fans out there.
There was an antibody question about if you have antibodies, does that mean that you're quarantined? And does that mean as long as you have antibodies, you don't have to quarantine if you're around someone? I think I answered that without doing serial antibodies every week to know where your levels are, and I don't even know that they do levels, then you would not know that to know whether you need to quarantine or not. So no, we don't use antibody levels as a way to avoid quarantine for people. And there's also a question about the self-reporting, and I think I followed the question. I will follow up with our OATS Office of Administration and Technology and see if we can do something to flip that for the person that asked the question. That makes sense for the rest of you. You have no idea what I'm talking about, but I'll try to fix that. Thank you for your question.
Next question, who ordered the vaccine? Was the health department ordering it, or was the district responsible? And if so, who did they contact if they're not using their health department?
Dr. Stack will be getting something to Commissioner Glass that will have a spreadsheet, and it will say Connie County, and then it'll say Tony Pharmacy. And the next line, it'll say Glass County, and it'll say local health department. Every county for private and public schools will have one vaccinator that they will be assigned. It may be the county health department, it may be a pharmacy that we have contracted with. In rare instances, it is an FQHC or an RHC, and in even rarer instances, it is the local hospital, especially if they have more vaccine than they think that they needed because of vaccine hesitancy. So you will be assigned a vaccinator, and there will be a contact person on that spreadsheet. So it will be no mystery as to who you're supposed to give those updated rosters to, so that person knows how to contact us and say, we need 300 doses, we need 500 doses, we need 20,000 doses like Jefferson County needs.
Okay. All right, going back, let's see here. There's some concerns from one district or a couple districts about communication between the district and the health department. Just wondering when they should be expecting communication on some of this stuff. So I think Dr. Stack kind of clarified that. Hopefully by the end of this week, they should be hearing something.
I would hope that, you know, he had a list, and that all changed yesterday. Remember our Etch-a-Sketch? So he's trying to get you a list that's as accurate as possible. And we don't want to send you a list today and then tomorrow change that and then tomorrow change that, because it looks like we don't know what we're doing, but actually we're trying to adapt what we're doing to the process that's going on out into the community. So that's why I said I really can't give you a timeline because we don't know that timeline. And for those who say, well, you know, can it be faster? It will be faster if we get bigger supplies of vaccine. If we can get more vaccine instead of that 53,000 doses we talked about, then we can speed this process up. But I don't want to tell you we're going to get more vaccine and tell you how fast that's going to happen, and then it turns out that it doesn't happen. So, you know, under promise, overproduce. I would much rather do that and explain to you why we are delaying this. And it's not that we're delaying this. We only have this much to give, and we're trying to find a way that we can spread that as equitably across the state as we can. And that's just not going to make anybody happy, because people that aren't getting it are not going to be happy. People are getting it are unhappy that they're not getting all that they want. And I just can't fix that.
Okay. This question had come in via an email from one of our districts, just wanting to make sure that if the educational doses that have been reserved will have the second doses set aside. So I guess, is there going to be enough for both doses?
Well, if you had asked me that question last week, remember my Etch-a-Sketch. If you had asked me this question last Tuesday, I would have said the federal government is keeping all the second doses. When they send a dose out, they're keeping the second dose at their place, whatever that place happens to be, so that they can send those second doses out when they're necessary. That philosophy has changed, and all of those second doses that are being stored are going to be sent out at some period of time. It's not going to happen January the 20th after the inauguration. It's going to happen sometime, and the thought process is that as those doses are being sent out, manufacturing will increase in order to be sure that we get that second dose. You don't have to worry about second doses. That will be done by your vaccinator.
Okay. All right. The next question that we have, let's go back to, let's see, just making sure we are not, I guess another question for Northern, it looks like they're just making sure that some areas looks like there might be severely under-resourced with vaccines. And there might be some concerns about delays with teachers in some parts of the state. What is being done to ensure equity in the vaccination access across the state?
Well, and that's why we've talked about this on a couple of meetings, or I guess it seems like a couple of meetings. I guess it was just a month ago that that we were not asking just for teachers to be put on these rosters. We wanted your entire staff. We wanted the school teachers. We wanted the aides, the school nurses. In fact, some of the school nurses are getting vaccinated in the 1A and may already have been vaccinated. We want your receptionists. We want your custodial staff. We want the people in the cafeteria. I double checked to make sure Friskies were getting added to the list, and they were, because we've got to have our Friskies. And I did get one of the emails questions you got was about, I think it was RECs. The question was, were they supposed to include their RECs?
The ATCs. That was I was going to go past.
Yes, and so some people did. So if you did not include those, and if your pecking order is that they report to you, then yes, they can be included. So if you have not included them, since we're not going to start unless your vaccinator calls you tomorrow, you can still add them to your roster. David, do you have any input for me there?
Yes, I was going to say that we actually surveyed all of the ATCs, and we sent those directly to your mailbox there.
Okay.
So we requested for our staff.
I knew I had gotten some specific rosters from them. I didn't know if that was something that the superintendents needed to do. So those folks are taken care of. Okay.
Yes, ma'am.
Hey, Dr. White, let's do one clarifying question before we move forward, just so everybody can be on the same page. So I want to make sure superintendents understood and heard what you said, as well as Dr. Stack. Eventually, we don't know exactly when, but information will come to the local district telling them who is their provider, and there will be a contact. When they receive that, there'll be a contact that says, here's your local provider, ask for, Kelly Foster, and here's the phone number. And then the local superintendent or his or her designee will reach out to the provider, and they will work together to start to make arrangements about when and where the vaccination will start at the local level. Is that correct?
That is correct. And it will be the vaccinator will, as Dr. Stack said, it may be you have your staff go to the pharmacy. It may be that the local hospital, if that's your vaccinator, has a drive-through. It may be that the local health department packs up the vaccine and comes to your school. That will be a relationship, and we will not micromanage that. Y'all will figure out between the two entities how's the best way for that to happen. And
so superintendents, we just need to stand by and wait for that provider list. I'm sorry, Dr. White, I didn't mean to cut you off.
No, I know he hopes he'll have it by Friday. I would say Monday, but so that way if he gets it to you by Friday, that's great. But I would say within this next week that we will have something pretty well tied down with. We will have everything tied down with each county, and because between now and next week, there's going to be, at least one county is going to call us and say, we were able to find the vaccine through our hospital system or wherever, and take us off the list. And we're happy to do that. But you will get a list with the vaccinator, with your contact, how you contact that person, and you will figure out how you will do this in your community.
And one more note on the rosters, if you have additional names, you do not need to send those to KDE, and you do not need to send those to Dr. White. You just add those additional names to your final roster that you're keeping in the district, and you'll use that as you work with your local provider.
Correct. And then that person will take all of the rosters from the county, will contact us and say, I need 400 doses, I need whatever doses, and as we can get them to you, we will do that as our supply will allow us.
Okay. Thank you, Kelly and Dr. White, on the quick clarification on those. Yes. I think one question that I skipped over, the first one, was how soon after COVID can you get a vaccination? So I guess that's a good question.
Right. As I said, you know, if I'm COVID positive, I don't want to come the next day and get a vaccination because I'm still infective. So you want to make sure that I'm not infective when I come in to get the vaccination. You also know that I will have some immunity for a certain period of time. So if I am with a group of people who are getting vaccinated, I may say, well, let me let the first few weeks other people go ahead and get vaccinated. I know I'm covered for a short period of time with immunity. I don't know how long. And then you can get your vaccine.
Okay.
But not while you're in that 10 days of isolation.
All right.
The last thing we want is your vaccination event to be a super spreader event, as we have seen in some states where people are standing in line in the parking lots waiting for vaccinations and they're spreading it to each other, which is not a good thing.
Okay, sounds good. All right, I'm typing in here to look for some more vaccination questions here. I know we have some on ESSER and some on the funding. I'm going to try to keep all of these together real quick. Let's see here. All right, I think we're going to hop over to there's going to be more. I know they're going to come in for clarification. But Robin, and if you and your staff can kind of get on the Q&A hats on. I have on the Google Sheet, I've highlighted yours in blue, and I'm just going to start from the top on those ones. Regarding the second round of CARES funding, will private schools be eligible to receive a portion of the funds as they were with the first allotment?
So for private schools, they will be allowed to apply for funds under the Gears 2 provisions of the funding. It doesn't address private school allocations under ESSER, but it does provide an opportunity for private schools to access under Gears 2. And that is part of that private $40 million allocation that is coming to Kentucky. We don't have all the details on exactly how that's going to work. We do know it will be administered at the state level. So the state will be, KDE will be handling that process. We are seeking additional guidance from US Ed on exactly how that's going to work. And we will continue to provide updates. Dr. Kelly Foster's office will be helping my Office of Finance and Operations, as we learn more about that and opportunities for our private schools.
Okay. The next question, can ESSER 2 funds be used for teacher salaries in order to have adequate staff for interventions?
Yes, ESSER 2 funds can be used for salaries to support those intervention and remediation services.
All right, and then as a follow-up, this one had come in via text. If we charge salaries to ESSER 2, do we charge federal fringes?
We're going to have to ask that for this round of funding. You know, last round we got that worked out. So we'll have to seek clarification to make sure that we are sharing the same. It may be exactly the same, but that one is worth an additional question to make sure.
Okay. The next one, under the ESSER 2 fund guidance, is it allowable to cover the cost of substitute teachers when a regular classroom teacher is absent due to a COVID-related exposure/test results?
Yes, that would be a permissible use of the ESSER funds.
Okay. Looks like the next question is, it was stated about there's not an equitable services requirement under Gear 2. Is there a requirement? That was a duplicate for non-public schools. I think we just covered that one. I apologize.
Well, and I saw that, Tony, I saw that question. It looks like it's been there a couple of times. Just for clarity, there are no equitable services requirements for LEAs under either ESSER 2 or Gears 2. The way that it's going to be handled as far as funding for private schools, those services will be provided through the SEA, which is KDE, and that will only be under Gear 2.
Okay. All right. Where will the ESSER 2 allocations be posted?
Tony, I've just asked Karen Worth, our budget director, to post the link to where those will be posted later this afternoon. And so if you could share that link with all of those that are participating today, we'd appreciate it.
Perfect. Yes, and I will, I did see that link pop in, and I will, when we send out the PowerPoint for this webcast, In addition to some of the other information, we will go ahead and I will be sure to put that link in there as well.
And it's not posted at this time, but for those of you that are familiar with our web pages, especially in our areas of kind of district support and budgets, it will be posted on our federal grants page. So that's where you can find it if you're familiar with that.
Okay. Great. All right. The next question. All right. I'm looking to see, Robin, do you see any that I missed on ESSER? I think everything else I've gotten on that. It looks like there might be something on GMAP. Nope. That was the same question. I apologize.
I think it might be worth noting, Robin, that we are working on cross-agency guidance on ESSER and GEAR, and we still haven't received everything that we need from ED yet, but we will follow our guidance protocol that we've been using since March. That guidance on the second round of funds will be released on February the 8th. And then on the February 9th webcast, that's when we will be going over the guidance document. So just know that it's going to take us a little bit of time to put that together because we haven't received everything we need from ED at this time. I will say that if it was an allowable expense under the first round of ESSER, it will be an allowable expense the second round of ESSER. There will also be some additions to that for facilities and learning loss. But if it was something you were able to spend it on the first go around with ESSER, it is also allowable the second go around. So that might be helpful just when you're thinking about planning as we continue to develop the guidance.
Okay.
Thank you, Kelly.
Thank you, Kelly and Robin. There is a question on last mile internet funds. Just to clarify, the last mile internet funds can be used to cover costs for appropriate things between January 1st, 2021 and the end of the school year, correct?
That is correct.
Okay. All right. Let's see here. I think that is it. We may want to shift back to a couple of questions, more questions on COVID. A question on the K-12 school COVID-19 self-reported data tracking. A question is wondering, could that information be reformatted so that the entry is made easier for districts?
That was the comment I was saying earlier. It sounds like she wants to flip that because you have, or she or he, you have to start at the top and scroll all the way to the bottom. And I'm going to see if there's a way they can flip that so that you would start at the top instead of I'm lucky I can get on this webinar. That shows how tech savvy I am. So I have no idea, but I will ask about that and let Tony know.
Okay. This next one, I think we're going to have to, these are some of our partners, but I'll go ahead. Maybe Kelly can help with this one. This question is there any way that we can have additional guidance in addition to the Healthy at School guidance to share with districts to scenarios that exist in learning environments? For example, their district was following the KMEA guidance for music instruction, but then needed to quarantine an entire class. They're just wanting to know, could there be guidance by department/content area? Dr. Foster, do you have any thoughts on that?
If there's an issue with something that's happened with the KMEA guidance, just reach out to me directly. I will coordinate and connect you with the KMEA coordinator. That guidance was produced by them and approved by Public Health, so that's really not in KD's realm, but I'll be glad to get you connected to that person. So feel free to reach out to me directly.
Okay. All right. Let's see here. One district says that they are struggling with current data to use for decision making on whether to have in-person school. Their incident map recently had a spike of 14 cases on January 6th, but in communicating with their regional health department, this number was due to a spike in their regional jail. So they're just wondering, I guess they're wanting to know, they're wanting to know if there's any advice with this struggle on how to use the data to make a decision on whether to have in-person school. So any advice from DPH or the department on that?
Well, sure. I think you either decide that your county is bad or horrible. You know, there is not a county in the state right now that just would suddenly be yellow if we were more current with our map. When you're doing the number of and I didn't bring the stair stepper chart. I think this is the first time I haven't brought the stair stepper chart to show you what it looks like. But we are at the highest rate. We have more cases this last week than we've ever had before. So for health departments to process that, and I know their district, and they are right. They have an amazing health department director there. Their regional director is wonderful. Everything is being processed as quickly as we can with the human capital that we have right now to process it. I think you can look at it, though, and say we have a problem. We are in a critical stage. If you have outbreaks in jails, especially a jail versus a prison, a jail is about a 3-day on average. I know some people stay longer, but when we started vaccinating people for Hep A, we couldn't keep up with the jail population because people come in and they post bail and they leave, and then somebody else comes in, and then that same person that came there 3 days ago is back in. And so there's a big revolving door. So if you've got jail outbreaks, you've got people coming in that were probably positive, or you've got staff coming in that are positive. And that's why correctional officers is one of the groups that we're trying to get vaccinated in the 1B. When we say law enforcement, we are looking at correctional officers to get them vaccinated. So this revolving door of people coming in are exposed to correctional officers that might be positive. So your jail is part of your community, so those cases do count. And all I can tell you is people are working as fast as they can. And I think you look at that, you look at your trends, you look at your community, and you make your decisions with the best information that you have. And in consult with since you've got that great health department director, I think that's someone that you can reach out to.
Okay. Dr. White, just a clarification on the regional distribution of vaccines from a superintendent. The question she was asking was why, and this is Northern Kentucky in particular, was getting such a small percentage of vaccines compared to other areas for the size of their region.
And I addressed that earlier when I said we looked at our population distribution, and there are some areas that are going to be getting less vaccine for the next week or two as we make sure that we make that distribution equitable by the population throughout the state. So that has been noted a week ago. We ordered, just so you know, we find out on Tuesday. The state of Kentucky is told today it's Day Tuesday? Yeah. We will not be told today if we still are going to get 53,000 doses next week, or 54, or whatever the number happens to be. We then have to enter into a computer system on Thursday night between 6 and 9 p.m. the doses that we want. Then we are notified the next day on Friday how many doses we will actually get and can actually be sent out on Monday. So if you're a clinic, you are not really guaranteed your number of doses for the next week until Friday the week before. That makes planning and vaccinating people a horribly inefficient way to do that. And that's what we've done every week since the middle of December when the vaccine first came out. So people are now telling us how much they need. We look at our total amount and we divide that up as best as we figure we can do that fairly. So it is a weekly job that we try to have to do. And as I said, we ran out of good choices about June of last year. So we have bad choices and we have worse choices. It is difficult to make those who gets it and who doesn't get it. And we are doing the best that we can in as fair and equitable a way as we can. And when we see that someone got an advantage over someone else, if it's something we can fix, we do that.
Okay.
I was emailing with Dr. Sadler, who is the health department director for that region, about 6:30 last night about dosing and communicating with St. Elizabeth, and so those conversations are being had.
Okay. Thank you, Dr. White. Robin and your staff, I think we're going to go back to you. We have a couple of additional questions on ESSER and GEAR. Can we use ESSER funds to pay the salaries of nurses we already have, or would we have to hire additional nurses?
You can use that to pay for nurses you already have.
Okay.
But we have lots of districts that could use additional nurses and additional mental health providers.
Okay. And then the next question is, can we use GEAR funds to pay the salaries of food service staff in excess of the number we would need to serve the lower number of meals due to COVID?
So remember, with the second round of GEAR, we haven't received information about how that is going to be permitted to be used. Just like the last time under the CARES Act and GEAR 1 under that, you could use it for food services. But at this time, we don't know what GEAR 2 is going to look like. As soon as we know that, we will update districts and let them know.
Okay. All right. I think that will clear us out. We had about 38 questions in the Google form, and I think that has cleared us out of all of our questions, unless I have missed something, Commissioner or KDE staff. I can go through and see if I've missed anything on here, but I think that clears us out of our questions for today. I can go ahead and put up the next slide if you'd like.
Sure. I think our was just closing after this.
Yes, it was a reminder about we have 2 webcasts in September. Boy,
Great.
I just jumped ahead about 10 months. Sorry about that.
Thanks. Great job managing all the questions. And thank you also to Robin and Karen for answering those questions about the federal funds that we have coming in, and to Dr. White for answering all those questions around vaccination and other COVID-related questions. We appreciate everybody being with us. We do have a couple of webcasts coming up to mark on your calendar. Tuesday, February 9th, we will be having that additional webcast. I'm sure there'll be more COVID-related items to talk about then, so we'll process through that. As this is an ever-changing dynamic, I think Dr. White's analogy of the you put your plans on the Etch-a-Sketch and then you shake it every day and start over. We'll have some different things to deal with at that point as well. And we're going to have better guidance, more information on those federal dollars and how they can be used. So we'll be releasing that, going into more depth around it, and then coming back on February 23rd. That'll be the date that we hope to have a panel of superintendents to talk about their plans for reopening, to share, not reopening, to talk about their plans for how they will create these experiences, quality learning experiences for kids using the significant infusion of federal dollars, and share those ideas and start some cross-pollination and thinking among our superintendents and districts. Thanks everybody for being with us, and we look forward to seeing you next time.